Hi, this is the Philosophical Angle program, and I am your host, Chris Angle. Along with me are my two co-hosts, Remy Canario, a political analyst out of New York, and Rick Samuelson, a venture capitalist who graduated from Yale, hides out on the West Coast. Good to see you guys.
See you.
Okay, let's start this week. The conversation is going to be the Democrat political debate of January 2016, and we're going to do a little bit of an analysis on the opening speeches by each of the candidates. And so let's start with let's take a look at the opening speeches. And Sanders came out and said, well, that's what our campaign is all about. It is thinking big. It is understanding that in the wealthiest country in the history of the world, we should have health care for every man, woman, and child as a right. That we should raise the minimum wage to at least $15 an hour. That we've got to create millions of decent paying jobs by rebuilding our crumbling infrastructure. Bernie Sanders obviously wants universal health care subsidized by the federal government. Okay, so we'll go into that a little bit. And Clinton, in her opening remarks, said, I would work quickly to present to the Congress my plans for creating more good jobs in manufacturing, infrastructure, clean and renewable energy, raising the minimum wage, and guaranteeing, finally, equal pay for women's work. I would also be presenting my plans to build on the Affordable Care Act and to improve it by decreasing the out-of-pocket costs by putting a cap on prescription drug costs, by looking for ways that we can put the prescription drug business and the health insurance company business on a more stable platform that doesn't take too much money out of the pockets of hardworking Americans. And third, I would be working in every way that I knew to bring our country together. We do have too much division, too much mean-spiritedness. That's a lot we have to do on immigration. There's a lot we have to do on immigration reform, on voting rights, on campaign finance reform, but we need to do it together. That's how we'll have the kind of country for the 21st century that we know will guarantee our children and grandchildren the kind of future that they deserve. Okay, so Hillary states that Obamacare is a stepping stone to universal single-payer federal subsidized health care. And so they both seem to, they both include in their opening statements and emphasized health care. So let's talk about that a little bit. I'm going to make a little analysis here, and the reason I'm going to do that is because essentially they're saying they want healthcare to be like the VA, that is totally government controlled, a single payer. And I'm not so sure that would be good for the U.S. economy, for the U.S. Health industry, and mostly for the patients. So I'm going to make a slight analysis here, but first between a private corporation, which is pretty much what has always governed and operated within the healthcare industry, and the VA, and the government and how it operates. So the first thing that we consider in the operation of a government-controlled, well, let's back up and go to the private entity first. First thing we consider is that a private entity is governed by the shareholders, which take an investment of capital They form a corporation. They write out the articles of incorporation. And that's similar to a government. The government has its voters and constituents, and it forms a government. And its equivalent to the articles of incorporation would be the Constitution. And then the representatives would be equivalent to the officers of the corporation. The employees of the corporation would be equivalent to the employees of the federal government. And the products and services they put out of a corporation will be equivalent to the products and services put out by the government. So it's pretty similar right down to this point. At that point, a private entity will have to put in a profit from the services and products that it produces, and a corporation uses that profit to repay the shareholders, and the shareholders use that profit to their own benefit, which is really what we all do when we earn a profit. When we go to work, we earn money to be able to profit from our work, so that we can use it for our own benefit. And but let's contrast that with at this point with the government. The government at this point, after it produces its goods and services, has no profit, and therefore from that profit there is a lack of motivation by its employees, and this lack of motivation produces an inefficiency, and therefore, because it doesn't have a profit, it knows no good nor bad, and the government is amoral, as it were. So, but there's a problem here when you have no motivation. The reason you have no motivation is because there's no incentive. So let's bring in an example, and the example in this case I'm going to put forth is the Veterans Administration Hospital services for the vets, and we're going to use that because it's very similar to how it would be if the United States let the private sector, if the United States takes away from the private sector the control of who pays for the health care, and takes it on themselves to pay for the health care. And so that's very similar to what the VA is today. And the VA, I think we can universally say, or at least most people would say, that it's kind of poorly run. And so let's go, and so what are the causes of why it's poorly run? Well, its characteristics are that the government pays for everything within the VA. And when government funding leads to an inefficiency, and we know that the VA is quite inefficient, but it has no incentive. Because there has no profit motive, there is no incentive for the doctors and the nurses and its entire staff really to give its patients, that is its customers, satisfaction for being there and administer the cures that they should administer for the patients. So we need to ask ourselves, what is the essence of incentive? So if we can figure out the essence of incentive, then we can see if this argument of mine holds any truth. And the essence of incentive is that it is the ratio of your sacrifice to your reward. So the more you sacrifice with less reward, obviously the incentive goes down. So this ratio is incentive. And so the less you work, commensurate to an equivalent reward, the greater is the incentive. So the VA doesn't really is not going to give good health care, because this hospital staff in its has no incentive to do so. Because in other words, if it increases its effort and time, that is its sacrifice for its patients, its reward will be the same. So it is just human nature that, given the lack of incentive, there is they'll just not work as hard. So with that said, I'd like to open up the discussion to you guys and see how you feel about the opening statements of Clinton and Sanders, especially about the Affordable Care Act and what it means for the United States. Remy, why don't we start with you? What do you think?
Well, Chris, I will dispute your characterization of Hillary Clinton's position. I think that she stated in broad terms that she has an ideological alignment with the idea of a single-payer system on some abstract level, but I do not think that she was proposing us moving towards Canada or Denmark style single-payer system. What she talked about specifically were improvements that could be made to the existing system to reduce costs and other such incremental improvements. That I think is certainly, given the political realities of the situation, an important difference and a much more realistic position to hold. Now, as to what you were saying in terms of government and incentive, now while it may be true that there are no shareholders earning profits, that doesn't mean that the people within the system don't have their own financial incentives. I mean, it isn't the doctors who are the shareholders of these insurance corporations that are making decisions for the veterans, and so they are compensated financially, and they are also compensated and incentivized in other ways. As physicians, they have chosen to care for people. They have chosen to make the health of others their life's work, and surely there's some form of incentive in doing that well, and that's inherent. All told, I think that a single-payer system has shown itself to be certainly the most cost-effective way of providing health care, and in some cases a very effective way of doing so. So it's something that's worth talking about. It's not a political reality in the United States. I don't think that that's what Hillary Clinton was proposing.
Rick?
Well, I'd like to point to two difficult issues the United States faces with its current legacy healthcare system. The first is that we have by far the most expensive system per capita in the world. No other country comes even close. So you're starting from a very, very high cost base. And any change to the existing system, if it's to move to a single payer format, if you will, has to be mindful of the enormous legacy costs that would need to be covered to increase the coverage, the expansion of the coverage, and so forth. So that's a big disadvantage for the United States in dealing with ever-growing healthcare costs, which continue to grow and have continued to grow throughout the implementation of the Affordable Care Act, and that's just a fact. So no one yet has figured out how to control the growth in these costs, much less pull them back. So that would need to be addressed before any changes could be made, in my mind. The second thing is that the whole world relies on the United States for particularly drug and other medical invention and development. And I'm in the biotech business, and I can tell you it's an extremely high risk, expensive business to be in. Only a minority of drugs ever make it to market. Most, in fact, fail in the various stages of testing that are required by the FDA in order to be approved. And the cost of the clinical trials and even the preclinical trials runs in the many millions. And to my way of thinking, the only obvious, unambiguous way to attack healthcare costs is through innovation. And I would argue that over time, as medical innovation, I'm talking not just about drugs, I'm also talking about device innovation. As that continues to improve, and to the extent that more risk capital is applied to these innovations, you really do have the opportunity to bring healthcare costs and prevention effectiveness down over time. And let me give you a very specific example. There are several companies that are experimenting with gene sequencing, what they call de novo gene sequencing. And what that means is that they're going to be able to, for a fraction of the cost, I mean, you may recall when the first human genome was sequenced, it cost, thousands and thousands of dollars, right? Well, we have the opportunity in this country over the next 5 to 10 years to bring the cost of sequencing a human genome down to $1,000. Okay, that is within sight. If you can do that, you'll be able to determine on an individual basis all of the potential genetically related diseases that a given person will likely develop over the course of his or her lifetime. There's already some indicators that show some of that stuff, but with de novo gene sequencing, you will have a perfect model of exactly what is in an individual's genome, and you're going to be able to do it for $1,000 or less. So I see the opportunity over time to bring down the cost of healthcare, mainly in scientific innovation.
Okay, Rick. Well, we understand your point that scientific information is going to create, and these are coming from private enterprises. As I take it, they're going to create more new medicines and new techniques, and it's going to reduce costs. And we understand that point. But is Hillary, or I should say Obamacare, not going to be able to do that under the if the single payer, if the government takes over becomes a federal health care situation? Is that not going to happen? Because that's really the point that we need to ascertain.
Well, let me underscore very clearly where I think the government could be of enormous assistance, and in fact already is. The National Institute of Health provides millions and millions of dollars in grants, right, to various biotech companies and other drug companies to help stimulate research, right? They do not normally take an equity stake. Those are not what they call non-dilutive grants. This is very different from what universities do. Universities, like University of Washington or Johns Hopkins, for example, they will take an equity stake and get a royalty stream from licensing technology to a private firm to further development into a commercialized product. I don't see why the U.S. government shouldn't reorientate itself so that it takes an equity stake. It provides limited risk capital that's supplemented by the private sector, because the government frankly doesn't have enough money and needs to be supplemented by the private sector. And then together, both parties do share in an economic profit. That's the way the government should be orientated, not for simply giving money away on a non-dilutive basis. And personally, I'm a beneficiary of the current government policy.
Remy?
Can I jump in here? You said that the world depends on the United States for medical innovation, and that's no doubt true. Although, I mean, obviously the British, the Swiss, the French, they all play a role as well. What I think is even more true is that the pharmaceutical industry relies on the United States for its profits. And to an extent that is, I mean, a bit ridiculous. We are essentially subsidizing the pharmaceutical costs of the rest of the world. And we can do something about that. There's a simple idea out there that would bring our costs more in line with the rest of the world and stop giving everyone else a free lunch. And that is to have the government for Medicare and Medicaid negotiate prices that are tethered to the prices that are paid in other countries. So if we say we will not pay 20% more than what another government is paying for this drug, the rest of the world's prices will rise, ours will go down, and we'll finally have a system that isn't so rigged against the United States. Now, yes, advances in innovation are extremely promising, and they have to be where we look at for the future of the system. But gene sequencing, for example, is just one piece of the puzzle, and it's looking like it's an increasingly small piece. I mean, we have found very few diseases or conditions that are caused by single genes. They tend to be much more complex, and so you have huge computing issues, and as well as the problems presented by epigenetics. I mean, we're just starting to get a handle on the effects of epigenetics, and so it might be a bit optimistic to look to that as the future of what will bring costs down, especially given that the recent drugs like Avastin and other biologics that have been coming out have in fact dramatically increased the cost because of their huge price tags. But I certainly agree that innovation is one area that we should look at and hope that it can help us drive costs down.
Well, I think that the original question here of whether the government becoming the national provider of health is overall a good thing or a bad thing for the United States, and I don't think that's clearly been answered yet. And I think we've got two problems here to discuss. First, should that happen, the government coming in is going to create an inefficiency because governments generally run at about 8 or 9 to 1 inefficiency compared to a private corporation. Just look at the amount of welfare dollars that are put into the system and the amount of welfare dollars that come to the end user. And you're going to overlay a terrible ratio of inefficiency onto a fairly efficient system, and both of you guys have delineated that the medical devices and the medicines that come out from the industry are right now pretty efficient. And so why follow Hillary and Sanders' suggestion that we go to a national health system? And in addition to the inefficiency, would the government have an incentive to bring money by itself? As Rick said, it's not providing itself with its own system of incentive to receive profit in terms of shares from the corporations to which they are investing. So I don't see any reason why we should change the system to a national health system like Sanders and Hillary have suggested. And so what are your comments? So we've got a few minutes left for both of you. Go ahead. Who's first? Rick, you go first. Go ahead. Okay, go ahead, Remy.
I am not sure that the evidence necessarily points to a single-payer system being all that inefficient. I mean, the fact of the matter is that people in the UK are very happy with their National Health Service. It has a wide spread of approval across the society. And if you look at a country like Sweden, which is often held up as like the poster child for what goes wrong when the government interferes. Well, over the past decade and a half, they have had a lot of really interesting ideas, especially when it comes to healthcare. They've reformed the system to emphasize public-private partnerships, and it works very well. Now, is that the right thing for the United States? Maybe if we had the chance to completely start over, we didn't have to have all of these vested interests, and we didn't have such strong ideological disagreements about it, it could be. But I certainly don't think that it's a productive use of anyone's time at this point to be talking about a single-payer system when, at best, it will once again divide our country the way Obamacare did. I think we need to move forward with what we have and just improve on the existing system, because that's what's possible.
Okay. Rick, final words.
Yeah, I take your point that having the government take over all of healthcare risks raising costs, it risks running at more of a deficit, and it risks providing an inferior service of the sort we see at the Veterans Administration, and it's kind of tragic what's happened there. And one has to be mindful with any kind of entitlement like this, that the costs are never brought under control, and the United States is now $19 trillion in debt and growing and continuing to operate on deficit spending. So, broadly speaking, if interest rates were to ever normalize again, the United States would be facing, a potential crisis just servicing the interest on the national debt. So I would agree with Remy that this is not the time to even consider a single payer system.
There is one more thing I'd like to say, though, and that's that the most cost-effective form of health insurance in the United States is Medicaid. So it isn't outside of the realm of possibility that the government can provide a service at a decent cost. I just don't think that it's a conversation that's worth having right now, because it's not feasible, and it would be a huge challenge to make it work, and we would need to be unified in an effort behind it.
Okay, guys, I want to thanks for joining us on the Philosophical Angle, and we'll see you next week. Thank you very much.
Thank you.
Thank you.